Much. Good morning, everyone. Good morning, everyone. Thank you so much for being here, and thank you very much to Dr. Miranda for inviting me to give this talk today. I'm really excited to speak with you about some of the work that I conducted while I was a graduate student at Marquette University. So I'll just introduce myself. My name is Alana McVey. I am a postdoctoral research fellow at the University of British Columbia, working with Dr. Connor Kearns and Dr. Pat Miranda on the Pathways in Autism study. I recently completed my PhD in clinical psychology from Marquette University, and I did my clinical internship at UCLA. I'm really excited to speak with you about the findings from these studies today. Thank you for being here. So before I begin, I just want to provide a land acknowledgement. So I just humbly acknowledge that UBC Vancouver is located on the traditional, ancestral, and unceded territory of the Musqueam people. I also want to provide a note about the terminology that I'll use today when talking about autism. So as a mental health provider, I've been trained to talk about autism using person-first language. So person with autism, child with autism, adult with autism. However, in recent years, autistic self-advocates and other autistic people have indicated a preference for identity-first language. So autistic person, autistic adult. And so in order to really honor individual differences in preference, I'll use both sets of terms today in my talk. So before I describe the studies, I wanted to provide a little bit of an introduction to PEERS, the Program for the Education and Enrichment of Relational Skills, for those who may be newer to the program. So PEERS is a social skills intervention that was developed by Elizabeth Lageson and Fred Frankel at the University of California in Los Angeles. PEERS is an upward developmental extension of the Children's Friendship Training Program. You can see the manual for that intervention here. So the Children's Friendship Training Program was developed for younger children, and Dr. Lageson identified a crucial need for these skills to be adapted for adolescents on the autism spectrum. So a little bit about PEERS. PEERS is a parent-assisted intervention, and it's really intended for adolescents in middle school and high school who have difficulties making and keeping friends. So it was developed for and predominantly tested with youth on the autism spectrum, although there is some preliminary evidence that the intervention also works for youth with ADHD. It was originally developed as a 14-week program, and it's intended to be delivered in a small group format, so a maximum of 10 teens and their parents. There are, as I said, 14 sessions, and these are held weekly for 90 minutes, and they occur concurrently. So the teens meet together in one room and their parents in a separate room. I'll provide a little bit more detail on the structure of the two sessions in just a moment. In terms of the topics and the sessions that are discussed in PEERS for adolescents, you can see them presented here. So as you can see, there's a strong focus on conversational skills, including how to trade information with another person, having two-way conversations, using electronic communication. And then there are skills for choosing appropriate friends. So how do we identify what makes a good friend? And then how do we go out into the world and find those people? There's an important skill on the appropriate use of humor. And then we move into how to enter and exit group conversations. After that, there is a skill on having get-togethers. So this is a really important component of the intervention for these youth to have get-togethers with potential friends. Related to that is a skill on being a good sport. And then after that, there are some skills focused on handling rejection and disagreement. So including teasing, handling bullying and a bad reputation, as well as skills for handling rumors and gossip. And then there's a wrap up and a graduation ceremony. So let's talk a little bit about PEERS for young adults, because the studies that I'll describe later have to do with both PEERS for adolescents as well as PEERS for young adults. So PEERS for young adults is an upward adaptation of PEERS. And in this intervention, rather than a parent session, there are caregiver or social coach sessions that are similar to the parent sessions, but I'll describe briefly the difference. So because this intervention is for young adults between the ages of 18 and about 29, they may or may not still be living with their parents. And so this intervention was developed so that parents or other adults in the young adult's life can attend the intervention with them. So this could be significant others or close friends or family friends, anyone that can provide that social coaching to the young adult. Again, this is for autistic young adults who have difficulties making and keeping friends. This program was developed as a 16-week intervention. And then similarly, it is a small group format. So again, a maximum of about 10 young adults. And then the sessions are similar in structure with 90-minute sessions with young adult and social coach sessions running concurrently. Here are the sessions and topics for peers for young adults. So you can see they differ a little bit from the adolescent program. In particular, some of the skills have been combined, and then all of the skills are discussed with a little bit more sophistication than in the adolescent program, so appropriate to the developmental level of young adults. So again, you'll see there's skills for starting conversations and maintaining conversations, how to find a source of friends, again, the importance of electronic communication and the use of humor, skills for entering and exiting group conversations and having get-togethers. And then one of the main differences in the young adult intervention are 4 sessions devoted to dating. So specifically, these skills are letting someone know that you like them, asking someone on a date, going on dates, and then kind of general do's and don'ts during those dates. And then the skills for handling disagreements, bullying, and teasing are also included in the young adult sessions. So in terms of the structure, and this is both for the adolescent as well as the young adult sessions, we begin with a rule review. So this is always very important when running group-based interventions, just to make sure that everyone in the group is very aware of any rules that are in place, and just to maintain the rapport of all of the group members. Then we dive into homework review and review all of the assignments that were given at the previous session. We focus specifically on things that went well over the past week, and then we spend a little bit less time troubleshooting what maybe got in the way of practicing the skills or what things maybe didn't go as well. After that is a didactic lesson where the new skills are taught, and these include role plays. So when we do the intervention in person, these role plays are conducted live. And there's something that everyone really enjoys. The adolescents, the young adults, as well as all of the group facilitators really enjoy demonstrating the skills, both poorly and then well, so that everyone can see the difference and the importance of the skills being taught. And then the adolescents and young adults get to practice those skills themselves in the behavioral rehearsal. So we'll pair them up with one another so that they can practice the newly learned skills and receive some feedback on that. So we aim to really give very positive feedbacks. We're thinking about reinforcing what we want to see in those behavioral rehearsals. Homework is assigned after that, and then the teens or young adults have the opportunity to do an activity together. And so this may depend on the location as well as resources available, but this is often board games or card games indoors, or if possible, sport activities outside. After that, the parents or social coaches rejoin the teens or young adults for reunification, where the skills that were taught are very briefly discussed. Homework is reviewed again, the homework assignment is reviewed again. And then after that, the group facilitators do individual checkouts with each family, just getting ready for the next week, checking in about who they're planning to have a get together with in the next week, or providing any individual feedback that needs to be handled. So the parent and social coach session structure is also quite structured, but as you'll see, it has a fewer components. So we begin our parent or social coach session with homework review. And then there is a handout provided to the parents and social coaches that outlines the skill being taught to the teens or young adults in the other room. So we'll talk through that together and answer any questions that the parents or social coaches might have about the skill. Homework is assigned, and then as before, reunification happens. Okay, so that is just a little bit of a primer on the peers interventions. So now I will move to talk about the first study. So this one is looking at peers for young adults, and here I'll describe improvements in social skills core to the intervention, as well as secondary improvements in social anxiety. So here is the citation for this study. So just to provide a little bit of background, young adults on the autism spectrum, we know face unique social challenges and often have fewer social contacts or social friends, social relationships than young adults in the general population. We also know that effective social skills are really necessary across several life domains, right? Not just have a vibrant social life, but also to get through daily living skills like going to the grocery store, banking, things like that, and then also in our jobs or careers. We also know that social anxiety, difficulties with empathy, as well as loneliness are really common for autistic people. And unfortunately, there are very few social skills interventions for autistic young adults, perhaps because autism is commonly viewed as a childhood disorder. There are just few interventions like peers for young adults. So in this study, I'm just showing you this flow diagram just so you can get a sense of our sample size. So you can see in this particular study of, again, peers for young adults, we brought in 56 young adults, and then we ultimately ended up with, I just want to point out, 24 young adults in our experimental group and 23 in our waitlist control group. And I'll describe what those groups are in more detail in just a moment. Here are the demographic details for this sample. So you can take a look. You can see here that the experimental group details are here and waitlist control are here. So you'll notice that they are predominantly male, mostly white, mostly non-Hispanic or Latinx, and then also fairly, their parents are fairly educated, and the household income is above the median. This was all conducted in the US at Marquette University in Milwaukee, Wisconsin. You may also notice in terms of their verbal skills, peers, both interventions are intended for adolescents and young adults who are verbally able. So you'll see that reflected here. So in terms of our measures, in this study, we really wanted to replicate the original findings of peers for young adults at the site of development. And so we used the same measures that they did. So we wanted to look at autism characteristics, and we did that with the social responsiveness scale. We also looked at social skills using the social skills improvement system rating scales. The peers knowledge, so this is the test of young adult social skills knowledge, was just asked about the skills taught in peers. To assess for empathy, we used the empathy quotient. And then we looked at direct social contacts. So how many get-togethers did the young adults have in the previous month using the quality of socialization questionnaire. And then I was really interested in looking at the potential effects of this intervention on social anxiety. And so we used two measures of social anxiety, the Leibowitz social anxiety scale, as well as the social phobia inventory. So I mentioned before that I would describe a little bit about the two groups. So in this study, as well as the other two I'll talk about today, we used randomized controlled trials. And so what that means is that our experimental group came in for their intake and completed their research questionnaires. And then they received peers right away after that. Then after peers was over, they came back in and completed those same questionnaires again. For the waitlist group, they also came in around the same time to complete their intake and research packet. And then they waited And then they came in again around the same time as the experimental group to fill out those questionnaires. And then they received peers after that. So this really allows us to compare the effect of peers to the potential effect of time, right? So here we're not comparing it to another intervention, but just to potential development across time. So getting into the results, so here are our findings for autism characteristics on the social responsiveness scale. So taking a look at this, you can see that the waitlist group is kind of the gold bar and the experimental group is the blue bar. So you'll see that from before intervention to after intervention, the waitlist control group didn't change at all. And the experimental group declined. So we're seeing fewer autism characteristics across the course of the intervention, which is the direction that we would expect. And just as we're looking at these, if you see an asterisk, it means that that finding was statistically significant, and the statistics are presented below. In terms of social skills, the social skills improvement scale has two subscales. This one has to do with problem behaviors, the CBP. And so in this case, we saw a similar pattern of results that we just saw on the SRS, where the waitlist control group stayed about the same, and the experimental group declined in problem behaviors, so also the expected direction of effect. We did not find a significant improvement in the social skills subscale. So you can see the experimental group is increasing in social skills over time, but the waitlist control group also increased a little bit. In terms of peers knowledge, here again, we see that nice direction of effect that we would expect to. So the waitlist control group showed no change over time, while the experimental group showed an improvement in their knowledge of peer skills. In terms of direct social contacts, we can see that the waitlist group actually declined slightly in terms of the number of get-togethers that they had recently had, while the experimental group increased significantly. A similar pattern was found for empathy. So here again, waitlist control shows basically no change across time, maybe even a slight deterioration in empathy, while the experimental group is showing a nice improvement in empathy. We did not find any significant effects for loneliness. So this measure actually has 3 subscales of loneliness. And so we are seeing for romantic loneliness a bit of a decline for the experimental group. However, we saw also an increase for the waitlist control group. So that finding is not statistically significant. And then the other 2, as I mentioned, for loneliness were also not significant. Getting into the extension measures, so looking at social anxiety, we did find for one of our measures, so the Leibowitz social anxiety scale, that there was a nice decline for the experimental group in terms of their social anxiety, while the waitlist control group showed no statistical change. We see a similar direction of effect for the SPIN, the social phobia inventory, but that was not significant. So this study was the first to replicate the results for peers for young adults outside of the site of development. And so specifically, we found effects in terms of improvements in autism characteristics, social skills, peers knowledge, and empathy. And then we also found these new results that demonstrated some improvement in social anxiety. So it's really interesting to consider why this intervention that was developed to improve social skills might have effects on social anxiety. And so since this study was published, there have been several others that have found similar results with different types of social skills interventions. And so this author put forth that perhaps after a social skills intervention, social situations just elicit less anxiety. Similarly, another author stated that perhaps the intervention provides kind of a level of predictability that then in turn reduces that social anxiety or anxiety in general, right? So if we think about the social world in its nuanced complexity kind of being decoded for these children, adolescents, and young adults on the autism spectrum, then perhaps that predictability means that they feel less anxious. And then I put forward this idea in this study that perhaps really an exposure-like process is happening. So these young adults who are participating in peers are learning these new social skills and they're practicing them together in the group, and then they're going out into the world and they're practicing them with other people. And so as they're learning these new social skills and they're starting to apply them in these real world contexts, it's quite possible that they are really exposing themselves to an environment that they have been avoiding for some time. And then, when they better understand the social world and know how to respond to it effectively, they learn actually that maybe it isn't quite so anxiety provoking. Okay, I will move now to talk about a second study. So here I'll talk about peers for adolescents, and I'll describe our findings showing improvements in depression symptoms and suicidality. So I want to highlight that this study was conducted by my colleague, Hilary Schultz, and I worked closely with her on it. So we know that social difficulties are related to isolation, loneliness, and fewer as well as less close friendships for those on the autism spectrum. We also know that suicidality is a major concern for autistic youth and adults. And I just want to note that since this study was published, we have even more evidence to this effect, right? So this article by Hervikoski as an example. So in general, we know that friendship and social connection in adolescence is really critical for psychological well-being and may even buffer against any negative effects of peer victimization. So here's that flow diagram for this study. So here we started with 88, and similarly to in terms of our final sample size, in the experimental group, we had 24, and the waitlist control group, 25. Here are the demographic details. So a similar composition, mostly male, again, mostly white, mostly non-Latinx, non-Hispanic. The primary measures of interest in this study were the Children's Depression Inventory, and then we used that quality of socialization questionnaire. So again, the one that asks about direct social contacts. So how many get-togethers did your child have in the past month? And then we used the suicidality item on the CDI to examine those effects. Okay, so taking a look at these results, again, the same color pattern holds. So the experimental group is in blue and the waitlist control group is in gold. So in terms of the CDI total, so kind of overall depression, you can see that the experimental group is showing a nice decline in depression scores across the peers intervention, while the waitlist control group is staying stable. Getting into those subscales on the CDI, you can see we saw the same pattern of effects for negative mood, anhedonia, and ineffectiveness. So you'll notice in ineffectiveness in particular, we're seeing a really nice decline in that aspect of depression over the course of the intervention. And again, the waitlist control group is staying quite stable. You'll notice that for negative self-esteem, this result was trending. So we're seeing a nice decline in the experimental group over time, but the waitlist control group is actually increasing a little bit. And then really surprising to us, the only subscale that did not show the effect that we expected was the interpersonal problems subscale. And so that may be that we're kind of seeing that decline across both of the groups. We also wanted to look at whether depression symptoms were associated with social contacts. And so as we expected, we did find that depression symptoms were negatively correlated with parent-reported social contacts at post-test, so after the intervention. And so that was true actually for the CDI total score, as well as all of the CDI subscales. So we're seeing that greater depression symptoms are associated with fewer social contacts, or in the reverse, the more social contacts you're having, the less depressed you feel. And then in order to look at suicidal ideation, because it is just a single item on the CDI, we really just looked at counts. So I wanted to note that endorsement of suicidal ideation did not exceed the mid-level on the CDI. So that item at that level is, I think of killing myself, but do it. So we use this item as a screener during the intake to assess for potential suicidal ideation. And so this item may also have resulted in youth who had higher levels of suicidal ideation, who maybe did not receive peers because they needed other care in advance. So for our experimental group, we saw 4 adolescents who endorsed suicidal ideation at this mid-level at pre-test, and at post-test, none of them did. So we saw that effect basically go away across the intervention. And then for the waitlist control group, we had a similar level, so 18%, 3 participants at pre-test. And this actually increased during their waiting period to 5 at post-test who indicated this level of suicidal ideation. So in this study, we showed evidence for improvements in self-reported depression symptoms, as well as suicidal ideation for those who received peers. And we also identified that these social difficulties, so specifically social contacts, are linked with depression for autistic youth. And then I think of importance, this worsening of suicidal ideation for the waitlist control group we found to be quite concerning, and really identified that the coordination of care may be necessary for those who can't, for whatever reason, enter a social skills group like this right away. So it's also really interesting, again, to think about why this intervention, which is focused on social skills, may result in improvements in depression. So as we found in this study, social connection is tied to depression for these adolescents. And we've actually followed up this work and identified that loneliness mediates this link between social behavior and social anxiety as well as depression. So loneliness seems to be a really important factor for adolescents and young adults on the autism spectrum. And so interventions that really foster this social connectedness and in turn result in decreases in loneliness may actually help to alleviate depression as well as social anxiety symptoms. Okay. All right, so moving into study 3. So this is a portion of my dissertation that I will present. And this again was conducted with peers for adolescents. And so here I will examine social anxiety and amygdala activity. So this is the citation for my dissertation if you're interested in reading it in full. Okay, so as we've talked about today, we know that social skills and social anxiety are really highly overlapping for youth on the autism spectrum. And we found that really targeting social skills can result in positive improvements in social anxiety as well. We've also recently identified in the literature that biomarkers may be especially critical to establishing treatment mechanisms and even testing treatment effects in autistic samples. And so for this study, I was really thinking a lot about the social brain. So the social brain is a set of regions that work independently as well as together to process social information in the world around us. So in particular in this study, I was really interested in the amygdala. So the amygdala is a brain region that's responsible for processing social and emotional information. And there's really interesting work that's been done on amygdala activation in anxiety in the general population, and then also amygdala activity in autism. And some of that more recent work really highlights and kind of puts forth this idea that we've seen a really mixed results in terms of amygdala activation in autism. And so it's been put forth recently that perhaps that variability that we've seen is really attributable to the presence of anxiety in autism. And so taking all of that information together, I really wanted to test whether baseline social anxiety was a predictor of change in amygdala activity across the peers intervention. So So you're getting used to seeing these consort diagrams. So here in this study, we assessed 71 youth. So again, this is peers for adolescents. And we ended up with 19 in our experimental group, and then 19 as well in the waitlist control group. MRI studies are a little bit tough for loss of data, as you can imagine. Here again are the sample characteristics and demographics for this sample. So you will notice in this study that our sample is entirely male, and so this was on purpose. So we only included male adolescents in this study because we were concerned about the potential of not having enough power to look for potential gender or sex effects. Again, the sample is predominantly white, predominantly non-Hispanic, non-Latinx. So in this study, we wanted to just make sure that the peers intervention was functioning as expected for this cohort of adolescents. And so we included 3 of the core peers measures. So the social skills improvement system, the social responsiveness scale, and the test of adolescent social skills knowledge. And then really our variable of interest for this study was the social anxiety scale for adolescents. So because this was an MRI study, we needed a task that would elicit amygdala activity. And so in order to do that, we used a one-back task, which I'll describe in more detail in just a moment. But this slide is just kind of a summary of what the task kind of looked like, or was how it was structured. And so in this task, the adolescents saw pictures of houses, faces, as well as scrambled images. And so you can see that there were 3 types of faces. So we had neutral faces, angry faces, and happy faces. Importantly, we chose to use adolescent images as opposed to adult images, since our sample was one of adolescents. And then this bar at the bottom just shows the order of presentation of the various blocks. So they saw houses, neutral faces, angry faces, scrambles, etc. Okay, so then this slide gets into a bit more detail about what the one-back task really looked like. So the adolescents first looked at a fixation cross, as you can see here. Then they saw an image, in this case, a neutral face, then another fixation cross, and then another image. And so the purpose of the task was really to ask the youth to decide whether the 2 pictures they saw were the same or different. So every time they saw a new picture, they would need to think back to identify whether or not the picture was the same or different from the one before it. And so the purpose of that is really just to ensure that the adolescents were attending to those images. So the data really show that any emotional face can elicit amygdala activation. And so in this instance, we used a faces versus houses contrast to really get that amygdala activation that we were looking for. Okay, so in terms of our results, we did in fact find that symptoms of social anxiety at pre-test predicted change in amygdala activity from pre-test to post-test for those who participated in peers. So more specifically, we found that higher scores on one subscale of the social anxiety scale, so the fear of negative evaluation subscale, which was completed by parents, predicted a greater decline in amygdala activity, specifically in the right amygdala, across the intervention. So we're seeing higher amygdala activity before the intervention and a decrease after the intervention, especially when we're considering this particular subscale, this aspect of social anxiety. And so you can see that depicted here in this scatter plot. So you can see this nice line, this kind of invisible line, if I were to draw it here, where the higher scores of parent reported fear of negative evaluation before the intervention were associated with greater change, so less amygdala activation after the intervention. And so just to show you some images of brains. So here, this is the experimental group. The pre-test is on top and then the post-test is on the bottom. And so I've indicated the amygdala here in this reddish, orangish yellow blob that you can see. So this is the right amygdala. And so you can see the blue then on top of that is the activation. And so this point here, you can kind of see it the best in this slice here. You can see that activation at pre-test. And then when we take a look at that same spot at post-test, you can see there's much less of that blue, much less activation for the experimental group in that region. And then for the waitlist control group, so here again is the amygdala, the right amygdala at pretest. So we're seeing that activation in blue there. And then at post-test, we're still seeing that activation, right? So we're seeing that decline in amygdala activity for the experimental group, but not for the waitlist control group. Okay, so again, in this study, we found that social anxiety, so specifically that parent report of fear of negative evaluation, predicted change in amygdala activity across the intervention. So again, higher social anxiety before the intervention resulted in a greater decline in amygdala activity across the intervention. And so this may really mean that those adolescents who have some symptoms of social anxiety may demonstrate greater social approach. So perhaps they are more motivated or more inclined to want to reach out, and may therefore show most improvements in terms of their behavior as well as their neural activity. Okay, so thinking about all three of these studies all together, we know that social connection and mental health are linked for autistic youth and young adults. And the peers intervention in teaching evidence-based social skills to youth and young adults on the autism spectrum seems also to promote mental well-being, specifically those declines that we saw in social anxiety as well as depression. And so again, it may be that our autistic youth and young adults who have some signs of social anxiety and depression before the intervention may greatly benefit from this type of intervention, both in terms of their social skills, but also in terms of these secondary symptoms of social anxiety and depression. I do want to note that more significant mental health concerns, really significant or severe social anxiety or depression, likely needs to be addressed before these youth or young adults could participate in peers. Okay, and with that, I just would like to acknowledge my graduate mentor, Dr. Amy Van Hecke, my fellow graduate students, in particular, Hilary Schultz, as well as Alex Barrington, who helped immensely with pre-processing the MRI data that I presented today. I'd also like to acknowledge our undergraduate research assistants, my clinical supervisors and faculty instructors at my graduate training program, and then the creator of Peers, as well as my internship mentor, Dr. Elizabeth Laugesen, and our funding sources. And with that, I'll thank you very much for your attention, and I'm happy to answer any questions that you may have.